Good morning and welcome to the Wavy Digital Desk. I'm your host, Sarah Good. Today we're going to be speaking about new AI technology that Sentara has been using from this spring to alleviate how doctors feel during their workday, their workload, amid this sort of ongoing physician shortage that we're experiencing across the country. Today we're going to be speaking with Sentara about what the software is, how they got started, and how providers are interacting with that software. Thank you both for joining me. Before we get started, I just want to introduce you both. We have Dr. Stephen Pierman here, Vice President and Chief Medical Officer of Primary Care at Sentara, and Stephen Payne, Regional Director of Business Operations at Sentara Medical Group. Thank you both for joining us today to talk about what this is, because I think to a lot of people out there, this might be new for them.
Yes, Sarah, thank you so much for giving us the opportunity to discuss this. And it is a new technology, but it's not necessarily a new problem. And we're excited about using technology and generative AI in particular to improve the way we provide care.
And I think the first thing off the bat I've heard, and I spoke to Dr. Wallace, who is with Sentara Medical Group in a practice out in Carrollton, and he said all the patients have been really receptive, which was a really positive thing to hear. But before we get started on talking about how this is working and everything, Stephen Payne, do you want to just start by talking about why finding advancing technology was so important to you all at Sentara Medical Group?
Yeah. So yes, and thanks for having me today. We've been working on this for 3 or 4 years. It started out with, how do we use human capital, human and medical assistance to help solve this problem? And it worked and it didn't work. And actually, it was Dr. Wallace who introduced a similar service, but using overseas staff, an overseas company to help with scribing. That led us to where we are today, using a product from Nuance to help with this AI scribing. And so it's been pretty phenomenal in the results.
But prior to this, you all have tried, or maybe some of the providers have tried other technology in the past?
Yeah, our providers have what we call Dragon, which is just a pure dictation service that's also provided by Nuance. And that works pretty well, but it's asynchronous to the visit. In other words, you have to go see the patient, then go out and dictate the note. Our providers, particularly in primary care, are overwhelmed. A Doximity survey says that 93% of family physicians rate themselves as overwhelmed. One of the things that overwhelms physicians and APPs, advanced practice providers such as nurse practitioners and physician assistants, is the time it takes to do administrative work, such as searching for information in the chart and documenting in the medical record. So the DAX Copilot generative AI is a real-time scribing. So it's just like me having a conversation with you right now, and the AI will create a note that happens. And so my job is to look at the note, review for accuracy, and then sign off on it. And it really reduces the time for documentation by a significant amount. It's pretty much like having a conversation like we're having right now, and then there's a structured note that occurs in Epic.
And I think it's important to know what you just said, that the doctors are taking and providers, are taking a look at it afterwards, right? It's not just going right from the chart and then it's done without the eyes of the provider. The provider maybe has to change a word or two or fill in the blank. I mean, have you all heard about how accurate it has been?
Accuracy's been it's very accurate. I would never rely on a computer to do all my work for me. There's a style and an art to medicine. And writing. And so every provider needs to look at that note. And, we have heard of some instances where it'll say something different, but that's where you review the note, you make the edits to make sure that it's exactly what occurred in the exam room with the patient.
And I'm going to pull up some video here just for people to see it in action in a second. But it's just, this was me being used as a test patient for what kind of data you're going to see on the screen here. But Dr. Wallace was able to walk me through a scenario talking about my back pain. I think it said I was like an almost 100-year-old patient. We talked about going on vacation and whatnot. And it was amazing to see both the accuracy, but also how it really did appear in seconds on the screen. You're here seeing a blank screen here, but he really clicked the app on his phone that you're seeing right here, and then within seconds, I think it was a 2-minute recording, he went back to a screen from his phone, and it had produced really the whole log of our conversation. And it was incredible. What have you all been seeing in terms of, providers utilizing this technology, back in the workplace? Have you heard about good stories or examples of how it's, been really helping them?
I think one thing is important is that there's a variety of ways that providers work. So DAX Copilot is not for every provider. Some providers are very efficient in the way they use with Dragon. That's our current or previous technology. But the ones that can adopt this and adapt to it have really given us remarkable stories. This is my favorite so far, really in the first day or so of introducing DAX Copilot. One of our physicians spontaneously responded to one of our leaders, hey, I used DAX Copilot Day in the context of what we're doing, the care model redesign. I got home by 5:30. All my notes were closed. My inbox was empty, and I actually got to watch a movie with my wife on a weeknight. That's our goal, right? To have that work-life balance back in the lives of physicians, nurse practitioners, and physician assistants, so they can really focus more time on the patients in front of them.
Right.
And that's going to be something I think patients will notice with this type of technology. It's not getting in the way. It's actually removing technology out of the relationship because it's a task I don't have to think about while I'm talking to you.
And I think, the average patient might not think about how much work the doctor's doing beyond the visit, beyond, maybe writing a prescription, beyond writing that order, but they're doing a lot. And I think that you all cited the American Medical Association saying just during the day alone, and there's also work on the back end, at the end of your day, doctors and providers are spending about 2 hours, it said, on documentation and paperwork for every hour of patient care. And that can create a huge backlog.
It does. We call that pajama time. Many times we had a previous program, Home for Dinner. Really, those are the things that people think, the hours that we're actually directly contacting patients are just the tip of the iceberg of the work and information that we review, gather, and document in there. And we have reports out of our electronic medical record that show how much time our providers are spending in notes and in-basket messages, and it stacks one upon the other, and really it almost becomes the majority of work on top of what we're doing with patients. And Stephen, I don't know if you have anything to add to that.
Yeah, I mean, you go back to when EMRs became a thing. They really created a mechanism to create a lot more work, and it's all good stuff. It's patient safety, it's good data tracking, but it's also created a lot of work. And so we do find providers that have across the country, not just Sentara, they're spending large amounts of time at home, late at night, trying to complete all the work they have to do. And Sentara is really focused on trying to make that better. We want them to have a life with their family, do what they need to do, stay healthy. And so this is one mechanism to doing that.
And I want to ask as well, people might be worried about the privacy standpoint. What patients have seen, at least with Dr. Wallace, is that it is private. Even those conversations of how are you doing? How was your trip? How have you been doing this year at home? How are your family? Those details were only included in the chart when pertinent to the actual diagnosis or reason for the visit. And I thought that was a really special filtering system, if you will, of what the technology could do.
Yeah, I agree. The cell phone is simply a microphone, basically a conduit to a secure environment that's HIPAA compliant, that meets all the things, same regulations and requirements of an electronic medical record. So it's just a kind of a one way to get into that record. But the standards for privacy, security, and firewalls and everything are in this is just as high as it is if I'm typing it in. So this just introduces efficiency, but it doesn't impact in any way the security and privacy of the individual's information.
And how many providers right now at Sentara are utilizing this technology or trying it out?
Just over 200 providers have licenses and are using the Access Copilot.
Wow. Because I think at one point this spring, it had only been about, 40, 41.
Yeah.
So for that number to jump, do you think that's word of mouth? Is that them hearing from you the success of it?
I'm getting messages from providers. It'll be a 5-provider practice. One provider will try it. Next thing you know, the other 4 are saying, I want it. Please sign me up. What do I have to do? So it's really exciting at how fast we're seeing results and how the word of mouth is traveling. It's very fast and allows us to reach more people.
Absolutely. And, with that amount of providers, what are you hearing maybe on the back end of how that's translating into their practice? Are they seeing more patients? Are they feeling more present, maybe in visits with patients? What are you all hearing on that end?
I'm hearing that they feel like their encounter with the patient is much more personable. The patient feedback is the same, that they feel like they're getting more from their provider. It's a better quality visit. And providers tell me that there are things they did not hear in the visit that AI picked up on. And it was like, oh, wow, that's a key data point. And so they can act on that. And so we're all human. There are errors and we don't hear things. We're listening too much. We're not listening enough, I should say. And this AI tool is acting as a help to our providers in that respect.
I think that's a good point. Distraction during a patient interaction is a human interaction. The computer and documentation can be distracting in that. And the most important things to patients is having a focused interaction with the person in the room with them. It's human connection. So this is one scenario where a computer actually improves the human connection rather than distracts from it. When you're having to type or look over at a screen, then you're breaking that connection. And as you're kind of multitasking, not really, you're shifting tasks. And during that task shift, sometimes you'll miss important information, as Stephen pointed out. This is actually one of the ways that we are trying to address the access problem. Cognitive burden or cognitive capacity is the ability to think about how many things can you think about in one day or one session. And there's hundreds of different data points that physicians and nurse practitioners and physician assistants are processing throughout the day and every encounter. So we can take one thing off and make a little bit more room for face-to-face time, or I don't have to spend much time in documentation. Then I can say, hey, let me add on in 1 or 2 patients. On the back end of careers where people are kind of feeling burned out and like, I'm ready to retire, and we do have an aging population of primary care physicians, it will probably extend their career because it's just not as hard as it used to be. So I've been in practice for a long time and went from paper to computer. And I will tell you that the burden of computer was much higher than a paper chart in many ways because it was much more things to click and process. And it really causes some degree of fatigue in our providers and staff having to do this all day long. So this is actually improving that human interaction. I think, like Stephen said, they're seeing it. Our patients are telling that to us. The eye contact, the attention, the mindfulness in that interaction improves with this technology.
That's great. And I was curious too, how long was the research process on this before you all put this in motion this spring? Are you constantly looking at new technology even now, new updates, new softwares coming out?
Well, I would say we've been doing this, like I said, 3 to 4 years and looking at different types of process and technology. This is the latest and greatest. This is really in its infancy. And this kind of AI technology, there's so much more it can do to help our providers and can be applied in many other circumstances, such as nursing in a hospital. So there's so much it can do, even for a medical doctor or provider. It's significant.
And I know it's being used in primary care offices. It's being used in, more internal medicine offices. Is this something that could, at some point in time, be shifted into being used, say, in emergency departments or in departments that are busy in hospitals? I mean, what would the transition be for that?
I believe that it will happen. There are certain specialties that don't find this as useful. We are into large groups across the country that share information. There was a recent exchange about what people are using the ambient technology of listening. Certain specialists like orthopedists who are really kind of more defined about what they're trying to do would probably find this less efficient. People that are processing and documenting large amounts of information during an encounter, medical specialist, maybe a rheumatologist, a cardiologist, a neurologist, this would be a really game changer for them. So it's going to find its place in different parts. And as we talked about, it will continue to evolve. This is a Microsoft product. There's a lot of investment in technology right now, and AI is at the top of that. And as that will evolve, we'll look for new use cases. I don't know that the competing technology, there are some other products, but this is a pretty almost like a first to market, very unique and kind of the forerunner in many ways. But we will monitor and look for new ways to use it.
And the understanding we all have of, generative AI is that it only improves itself, with users and with people actually incorporating this into their practice. So I guess you'd hope, even as just your doctors use it, that it's getting better and better.
Yes, it is. And it does self-repeat. The one thing I want to make sure everybody understands, this does not make a diagnosis. It does not create clinical judgment. It's really just organizing the ideas and the thought processes of the provider and the patient interaction. Everything about medical decision-making still relies on the human. And it's really important to have that human connection because humans, respond to human motivation and influence. The computer can help me. I like this term of cobot. It can do things that make me more efficient of the things that only I can do.
Absolutely. The one thing I did want to ask too, this is just sort of one piece of the pie really in addressing that physician shortage. And you all are trying to find ways to alleviate, what doctors are feeling amidst the workload every day, especially as we're hearing about, 10-month wait times across the country for some people, especially as a new patient getting an appointment. Are you all seeing that this is actually alleviating maybe some of the stress doctors have been feeling from that, over the past couple years?
Absolutely. I was talking to a doctor yesterday, and he said that he's able to get in 2 to 3 more patients because of this kind of technology and the efficiency it brings in the day. So not only are they bringing on more new patients, but they're able to get out of work on time to go be with their family.
That's a great thing to hear, and I think Dr. Pierman, you were talking about what people can do in terms of, what did you call it, pajama time. And so I think that probably helps with the burnout end as well, is actually having time in your life that, whether compartmentalized or not, that where you can have some peace and some time away from the practice so you can be super present in those appointments.
Yeah, we know that our providers want to see patients. That's what they went into healthcare for, because they want to see patients. And the things that distract them from seeing patients, like the documentation, information gathering, message management, it frustrates them. And it's probably the largest cause of burnout. It's not seeing you as a patient that burns me out. It's the stuff that generates from that. And so as we address those issues, I think the joy of medicine will come back to our providers, and the patients are going to feel that too, because if your provider feels engaged and undistracted, and they will understand that it'll be better for both the physicians, the APPs, and the patients.
And I know that we talked about all the doctors joining in on this, wanting to utilize the software and the reasons why patients should not be nervous about this technology. But what would you say to doctors who maybe don't have as much experience, perhaps working with technology? Is your suggestion just to try it, just to see how you like it, and just maybe see with a couple patients how it works in their practice?
Yeah, I've encouraged some providers who just don't know. Hey, try it. If you don't like it, I'll reuse that license for someone else. But most providers, they use it, they stick with it. So some need some extra help, and that's understandable. I do have a provider that actually trained himself. It is very intuitive. It's simple as you saw, clicking a button, speaking, and having someone do all the work for you on the documentation side. So, yeah.
That's great. I mean, anything from either Stephen Payne or Dr. Pierman, to wrap this up, anything that you want people to know going to Sentara about getting that patient care, or anything that you're looking for in the future, hoping to maybe see within this software?
My main focus as a leader within the medical group and the Sentara Health is to increase access for patients. That's our primary focus, and I spend most of my days trying to improve that. The reality is doing things the way we've always done them, with physicians providing almost everything a patient needs, isn't going to work. So we need a combination of offloading things that are lower value work, like documentation or managing a refill that's stable and chronic, and improving the way we provide access for different types of needs, whether it's a simple sore throat or a complex medical condition. We can use that in a team medicine fashion, with a care team providing that. And we actually, for one example, we have a 24/7 nurse advice line. There's no doctor that's on call every day of the year. So, but that's kind of where our team can extend that convenience and access to patients. So things like DAX, in combination with the way we redesign our care delivery model, I'm optimistic in the next year we'll probably start seeing a lot more access availability in the markets we serve.
That's great. And Stephen Payne, anything,
I think I want to say that, you hear about AI in the news, other topics, and how you can go on your computer and go to an AI tool through the internet. This is different. This is what I call a closed forum. So it's not the same as what you see out there on the internet. And Sentara takes the privacy and security of our data for our patients to the highest levels. And so it is very safe. It's very effective. And it is, I've been at Sentara for 23 years. It is probably the most exciting project. It is the most exciting project I've ever worked on. And it's an honor to be able to help our providers and patients.
Absolutely. And I want to say, it's called DAX Copilot, and Dr. Wallace made it clear he's the pilot of this. He used that expression, and it is just helping him, maybe fixing a word or two. But for the most part, just what you all have said in this conversation, it's allowed him to be more present. He thinks that his patients have noticed, what's been going on, have been receptive to it because they've been able to see with their own eyes how it's made him, get back to his patients, if you will. But thank you both so much. Thank you to everybody watching. If you have any more questions, please head over to wavy.com, where we connect you back with information from Sentara on DAX Copilot, provider experience, and also more information from my interview with Dr. Wallace that will be on Wavy tonight. So thank you both so much for joining me to talk about this exciting technology, and hopefully we'll just see where it continues in the future.
Sarah, thank you so much for allowing us to kind of share some of the things.
Absolutely. Thank you both so much, and thank you for your time. And again, please head over to wavy.com for more information.